Okay, so you want to buy a nursing home. Buy a building, hire the nurses, collect the checks. On paper, it's the most predictable business in America. 14,742 facilities, 1.2 million occupied beds, $126 billion a year, and every new customer delivered by demographics instead of marketing. But here's the strange part. On its own filings, this industry earns 0.58%, half a cent on the dollar, the margin of a charity with a parking problem. And yet last year, buyers paid a record $105,600 per bed in a market where the number of deals just jumped 37% in a single year. The most sophisticated money in the country keeps paying record prices for a business that swears it's broke. One of those numbers has to be lying. By the end of this video, you'll know which one, where nursing home money actually hides, how the second largest chain in America went bankrupt while its owner got every dollar back, and why a nursing home isn't really the business you think it is. Nursing homes come in three sizes, and the price tags barely describe the same industry. At the bottom, in March 2025, a real estate trust bought a 100-bed skilled nursing facility outside Oklahoma City for $5 million, $50,000 a bed. The car you drove to this fantasy cost more than two of them. In the middle, last December, 5,000 beds across 7 states sold in one portfolio for $545 million. That's $109,000 a bed, almost exactly the national average. And at the top sits Sandstone, Spring Valley, and Las Vegas, 160 beds, $52 million, $325,000 a bed, a state record, sold by brokers who are openly calling 2026 a feeding frenzy. For calibration, the national average was just $83,800 a bed in 2024 because the market that year was clogged with distressed sales. In this industry, even the discounts come with a backstory of somebody else's collapse. Now, the two costs nobody warns you about. First, in most of America, you cannot simply build a nursing home. 35 states plus Washington, D.C. require a certificate of need, a government ruling that your new beds are needed, and at least 13 states run outright moratoria on new long-term care beds. No new beds at any price, no matter how rich you are. So the scarce asset was never the building, it's the license. The bed you're buying isn't furniture, it's a permission slip with a mattress on it. Second, the purchase paperwork itself. Medicare's billing agreement transfers with the building, but through a process where 30-day deadlines run in every direction. File the enrollment form within 30 days. Deliver the signed sale agreement within 30 days of the application, or the reviewer, in the manual's own words, shall reject it. Get the ownership disclosures wrong, and they can terminate the billing number entirely, which turns your $5 million facility into a very quiet building. And since October 2024, that same form asks you to name every private equity firm and REIT standing behind you. The government has started keeping a list of people like you. You'll be on it. Okay, so you've picked your building. Now the question that actually matters. Where does the money come from? Not from the residents, from the labels the residents wear. Watch one bed. Same room, same mattress, same call light. If the person in it is on Medicaid in Illinois, the state pays about $260 a day. If her family is paying privately, the national median is $355. And if she arrived from a hospital within the last 100 days, Medicare pays about $540 a day. Same bed, 3 prices. The paperwork alone can more than double the revenue. And the 3 payers behave like 3 different businesses. Medicaid covers 63% of everyone in the building and pays a median of 86 cents for every dollar the care costs. It's the guaranteed tenant that guarantees you a loss. Medicare is the exact opposite. MedPAC is the commission that referees Medicare's rates for Congress, and it reports the program paid nursing facilities a 24.4% margin in 2024. That's the 25th consecutive year above 10%. But Medicare only pays for the first 100 days after a hospital stay, covers just 14% of the building, and then it's gone. So, run 2 customers side by side. A hip replacement patient fresh from the hospital brings $540 a day at that fat margin, roughly $130 of profit per day, and she'll be discharged in a month. A long-stay Medicaid resident loses you money before breakfast and will keep losing it for years. Your best customer leaves in 30 days. Your worst customer never leaves. That one sentence is the floor plan of every modern facility. The rehab wing gets the renovation, the fresh paint, and a concierge relationship with every hospital discharge planner in the county. The long-stay corridor gets the staffing ratio. And the private payers, the $335 a day families, at $129,577 a year, 1.5 times what the median American household earns before taxes, are temporary by arithmetic. They spend down to broke without ever changing beds, then convert into Medicaid residents. Every private payer is just a Medicaid resident with a countdown clock. The facility reads that clock better than the family does. Which brings us to what you'd actually be buying. Because it is not a healthcare company. A nursing home is two businesses stapled together. A care operation built to break even and a property built to get rich. That half-a-cent industry margin? Here's the part the filings don't advertise. It's calculated after 77% of facilities pay a combined $11 billion a year in rent, management fees, and staffing contracts to companies owned by the same people who own the facility. Medicare's own audit manual has a phrase for this arrangement. You are essentially dealing with yourself. Strip those payments back out, as government researchers did, and the margin runs closer to 9%. The poverty is a presentation. The operating side exists to lose gracefully, and the winnings are collected next door, by you wearing a different hat. So why not just run the care side brilliantly and keep both halves? Because the operating side is a fixed price contract with floating costs. The industry's own medians total up the median facility. $131 for nursing, $62 for administration, and $24 for the dietary department. The categories sum up to roughly $290 per resident per day. Illinois Medicaid pays $260. On the industry's own medians, the standard resident is $30 underwater before anything goes wrong, and things go wrong hourly. A staff nurse costs $43 an hour. The agency nurse who replaces her when she quits costs $68, a 75% premium that arrived with the pandemic and never left. Then the lawyers. Actuaries price expected lawsuit losses at $2,970 per occupied bed per year, and that's the national average. Kentucky has run past $8,000 a bed. Post-tort reform Texas sits near $300. Your legal exposure has a zip code. Texas will even pay you an extra $1.67 per resident per day just for carrying liability insurance, the only state that tips you for being suable. Then there's the line item I won't joke about. Half of American nursing homes spend less than $12.03 a day feeding a resident. All 3 meals. More than a quarter spend under $10. The worst spend 4 to 6, and the inspection reports describe meals residents can't eat. There is no federal minimum on food spending. When the rates are fixed and the costs float, dinner is one of the few lines an operator fully controls. Those numbers show you who's been controlling it. In 2024, this industry almost got its one cost floor, a federal rule requiring 3.48 nursing hours per resident per day. The rule died 3 separate deaths, struck down in 2 federal courts, blocked by statute until 2034, formally repealed this February. So your biggest cost has no legal minimum, your biggest revenue line is set by a legislature, and the only fully adjustable number in the building is the payroll of the people doing the actual caring. Which brings us to how owners lose, and the one way they don't. In 2007, the Carlyle Group, one of the largest private equity firms on earth, bought HCR MaноCare, America's second largest nursing home chain, for $6.1 billion. $4.8 billion of it borrowed, $1.3 billion in equity, plus a $61 million fee Carlyle charged for performing the purchase. Charging a fee to spend other people's money is a move you'll want to remember. 4 years in, Carlyle sold just the real estate, the buildings and the dirt under them, to a REIT for $6.1 billion. The buildings alone sold for the price of the entire company. The equity came back whole. And from that day, the nursing homes paid rent on buildings they used to own, $472 million a year, escalating 3.5% annually, with taxes, insurance, and upkeep on top. 6 months later, Medicare cut its rates by 11%. A rent that only rises met revenue that just fell, and the chain never recorded an annual profit again. What that looked like from inside the buildings, I'll tell you straight. Health code violations across the chain rose 26% in the 5 years before the bankruptcy, nearly 3 times the national rise. Staffing ran 10% or more below the national average. At one Pennsylvania facility, lawsuits went from 1 to 10. Inspectors logged residents left waiting in their own waste, and an aide described covering a floor of 60 patients alone. One aide, 60 patients. In March 2018, ManoCare filed for Chapter 11. The chief executive collected $117 million in deferred compensation. Carlyle had recovered its stake 7 years earlier, plus roughly $80 million in fees, and the company's statement noted, accurately, that not a single creditor lost a single penny. The residents were never creditors. So the lesson, dear future owner, comes in 2 sizes. If you're the operator, a sale-leaseback doesn't take profits, it sells every future margin at once, and rent is the one cost in this business that never has a bad year. And if you're planning to be the landlord instead, the seat this entire industry funnels toward, know that even landlords bleed. Omega, one of the biggest nursing home REITs, watched its tenant La Vie slide through rent cuts, facility sell-offs, and Chapter 11 before the lease was reassigned to a fresh operator at $3.1 million a month. Omega's old loans to the dead tenant are still on its books, accruing interest it will never see in cash. A lease is only as strong as the payroll of whoever signed it. Time to pull it all together and answer the actual question. How much money do you make if you do this right? 3 scenarios, real numbers. Scenario 1, the Oklahoma facility. $5 million, 100 beds, and at the industry's median occupancy of 83%, call it $9 million a year in revenue. At the median operating margin, 1.8%, you clear about $160,000 a year in revenue. Payback? 31 years. 31 years of flu seasons, agency invoices, and surprise inspections to earn back what the building cost. Now run the same building from the other side of the lease, the way the trust that actually bought it did. $500,000 a year in rent, triple net, meaning the operator pays the taxes, the insurance, and the broken boiler, with 3% raises written into the lease. That's a 10% cash yield. Payback? 10 years, collected by mail. Same building, same 100 beds. The operator waits 31 years, the landlord waits 10. Scenario 2, the chain. $545 million for 5,000 beds across 7 states, roughly $456 million a year in revenue. On reported industry margins, the math is a punchline, which is why nobody who buys at this scale runs it on reported margins. You run it the way 77% of the industry does. The facilities pay rent to your property company, fees to your management company, wages to your staffing agency, and the true economics land near that adjusted 9%. Call it $40 million a year. Payback? 13 to 14 years, and every one of those years the money exits through doors you also own. It isn't one nursing home company, it's a family of companies holding hands around a Medicaid check. Scenario 3, the Carlyle. Put up $1.3 billion, buy for $6.1 billion, mostly with borrowed money. In year 4, sell the real estate alone for the full $6.1 billion. Your stake is back, plus $80 million in fees, and everything after that is upside on other people's rent. Payback? 4 years. And notice what it never depended on. Not a single patient, not a single nurse, not a single inspection. If the operator survives, you're a visionary. If it dies, you were paid in 2011. So the two numbers from the beginning were both telling the truth. The half a cent is real, and so are the record prices. They just belong to two different companies, the one doing the caring and the one collecting the rent. If you're going to buy a nursing home, know which one you're signing for, and whatever you do, don't be the tenant. Subscribing, on the other hand, is the one lease in this business you can walk out of. Sign freely.